Margot Burnell, president of the Canadian Medical Association. Great to have you on your morning.
Thank you very much.
So this new express entry program is for foreign trained doctors or practice doctors that have at least 1 year experience practicing in this country within the last 3 years. And doctors eligible for the pathway include general practitioners, family doctors, surgical specialists, and laboratory medicine specialists. So compared to the current system, what does this program change?
So this program changes a couple of items. One, it allows physicians that are internationally trained to obtain their permanent residency status in a much quicker fashion and to gain the benefits of that with respect to applying for jobs and other benefits within the country. The second announcement was an increase in the provincial nominee numbers and an additional 5,000 slots above the current numbers.
Ottawa, we know, is creating new admission spaces for foreign doctors. Physicians selected, there'll be 5,000 new spots. They'll have their work permits processed within weeks. And a reminder to everybody, this process can sometimes take years, so this is quite an increase. This means that doctors can start seeing patients while their applications are in motion. So who's eligible for those 5,000 spots?
So those 5,000 spots are open to physicians that have been nominated by the province, so they have a job offer. And then those physicians still need to be registered with their provincial college and have credentials with their local health authorities.
Monday's announcement comes as this country continues to grapple with the shortage of physicians. According to Health Canada study from earlier this year, everybody can quote that number of, 6 million Canadians don't have access to regular primary care. But here's the spots that are missing. Nearly 23,000 family doctors would be needed to fill the needs of this country. So how far do these new measures go in making up that shortfall?
This is just one step in trying to close that gap and to increase the number of family physicians across the country and to increase access for patients to primary health care. So that is what this measure is trying to address, but we need other measures. We need to increase training spots. We need to retain those individuals working with us. So this is one approach.
Yeah, Dr. Burnell, that's my next question to you. For years, everybody knows the stories of doctors who have educated abroad, they've worked abroad, they come to Canada, they can't practice in their field because they don't have access to a Canadian medical license. So what needs to be done to get those doctors working?
So those doctors need to work with their provincial colleges and have their training assessed, and then any gaps that are identified can be corrected. That may mean more training, that may mean supervised assessment of their practice capabilities. We want to ensure that these graduates and trainees meet our current standards and are safe to enter the workforce.
So if I'm understanding you correctly, the speeding up the immigration process is federal, but getting them licensed sits with the province. Is that right?
Correct.
Okay. Applications for the new express entry program are going to open in the new year. So what are you going to be watching for to determine whether or not this pathway is making a difference?
We'll be looking to see how many physicians take this opportunity, and we'll be looking to see if access to care for patients improves across the country with this initiative.
Dr. Margot Burnell, president of the Canadian Medical Association. Great to have you on your morning. Thanks for coming on.
Thank you very much.